This one, you want to be able to pick out ventricles, you want to be able to pick out lobes, you want to be able to pick out sulci and fissures, because that's what I'm going to be asking you on both of these. All right, how do I know that this is the back of the brain over here? How do I know that?
The cerebellum.
You see the cerebellum? Yeah, you know, cerebellum is there. And then what are all this whitish pattern of lines called? Arborvitae, yeah. So if this is the cerebellum, then what lobe does this have to be? Occipital. If that's the occipital, then what lobe is up here? That's got to be the frontal. What ventricles are these? Lateral ventricles. Okay, now especially back here. Here's my cerebellum. Here's my occipital lobe. This is my frontal lobe. There's a deep, deep line right here. Who is that line?
Transverse fissure.
Transverse fissure. There's another little sulcus right here. If this is the occipital lobe and this is the frontal lobe, then what lobe is this? Parietal. Then what do we call this sulcus? Parieto occipital sulcus. I guess it's right here. There's another sulcus right here, separating the frontal lobe from the parietal lobe. Central sulcus. Do you see these? Do you hear these guys? These guys are good. Okay, so we have all of our lobes. We've got the parieto-occipital, we got the transverse, we got the central, we've got the arborvitae, we've got the lateral ventricles. What else? The only other thing I can ask you is this round thing. That's the pons. All right, over to our coronal section. Couple of questions the same, couple of questions are going to be different. Deep, deep fissure. Longitudinal fissure. Holes on both sides of the cerebrum. Both of these are lateral ventricles. Yes, they are. This is higher in the front of the brain, and this is towards the back of the brain. They kind of curve over. If you look at your book, photo on the book, you'll see the ventricles are higher here. They're lower in the back of the brain. You can see some brownish stuff inside these ventricles, and if you could see up close, they would look like little tubes. Who are they? What? All right, they are capillaries. What do we call them inside the ventricles?
Choroid plexus.
Choroid plexus. They got it. All right. We have a white bridge that goes back and forth between the left and right side of the brain. Here it is again. A white bridge going back and forth between the left and right side of the brain. Here it is in this section. You got this, Sam? This big white C-shaped thing. It's all the same thing. It's all the same thing. In a woman's brain, it's larger. Who is it? Corpus callosum. You got it. Now, what part of the brain is this? Cerebellum. What's this deep line? Transverse fissure. Who's this round guy here? Pons. Remember the fibers that go up and down. Now, if you're good, and I know you are, there's a line right here which is the same as the line right there. Be careful. You're in a coronal section. You're in a coronal section. It's a sulcus. Which one is it? No, but I'll give you a gold star for trying. All right? Lateral. Remember, this is a coronal section. Look at me, Sam. Coronal section is sliced like this, right? Temporal lobe, parietal, frontal, right? So that line is right there. You're in a coronal section. Right there, coronal section. So, if this is lateral sulcus, then what lobe is this? Temporal. You got it. You got it. Last question. We've got a couple of lateral ventricles. There's a thin piece of skin that separates the lateral ventricles. One of the first things I mentioned today. Septum.
I'll buy a valve.
Look at me. And there's silence in the ground. He wants to buy a valve. All right. I'll give you a gold star for that. I'll tell you what, camera, it'll be on your lab test. Find it in your notes. Got
You're gonna be
it?
a YouTube star, sir. You're gonna be a YouTube star soon.
Yeah. Tonight.